Hi doctors, this video is just for you. In this video, I'm going to explain how to approach a writing task, how to use your 5 minutes reading time effectively, how to demonstrate the 6 assessment criteria in your writing, how to use the sample answer provided, and how to learn from completed writing tasks. So let's get started. The medicine writing test includes 3 possible types of letter: referral, transfer, and discharge. The reader of your letter could be to a number of different healthcare professions, for example, doctor to doctor, doctor to specialist, or doctor to an allied health professional such as a physiotherapist, a dietitian, etc. Until you turn over the test booklet at the start of the reading time, you don't know which scenario it's going to be. The most important point is to be prepared to be flexible, to meet any one of these letters and readers. Every patient is different. Their social background, their medical history, their current situation, these will all be different. Just like you wouldn't speak to each patient you meet during your working day using the same language and expressions, you need to be ready to use language and paragraph structure to make your letter personalised to this patient and this situation. Only then will you be demonstrating to the assessors that you have the English required to score a B grade or higher. Turning over the test booklet, there are 3 things you want to check as a priority. Although you cannot highlight or make any marks on your test booklet in the reading time, I'm going to highlight these 3 things so you can clearly see what my eyes are looking at and can follow the approach yourself. The first 2 pieces of information are provided at the end of the case notes, so go straight there first. Who are you writing to and what is their job role? In this example, we can see that we're writing to Ms. Graham, who is an occupational therapist. What are you writing to Ms. Graham about? You are going to explain Mr. Jones's situation and request an assessment of his workplace. Back at the start of the case notes, you will find the 3rd piece of information. What is your role in this patient's care? So we can see that Mr. Barry Jones is a regular patient of yours. Although you might not have practiced writing a letter to an occupational therapist before, this isn't something which needs to concern you. The approach in each case is the same: to think about the reason for writing to the reader and selecting information which will enable them to continue caring for this patient as per your request. Before I start reading the case notes from the beginning, I want to make sure I have completely understood the reason for writing the letter. So another good place to check for any detail about this is the last information in the case notes. Checking here, I can find one other piece of useful information, which is that I want the OT to advise on duties the patient can perform. From all of these pieces of information combined, I can understand that I am referring my regular patient, Mr. Jones, to an occupational therapist for a workplace assessment. With this in mind, and remembering the specific reasons for writing this letter, to detail Mr. Jones's situation and to request a workplace assessment, I can start reading through the case notes line by line, deciding whether each one is relevant to the reader or not. To help make the decision, I will ask myself 2 questions each time. Is this case note relevant to the current situation? And will this case note affect how the reader continues care for the patient? If the answer to both questions is no, I can omit this information. But if the answer to either question is yes, I will include this information somewhere in the letter. In the reading time, you have to make mental notes as you read for your understanding. I'm going to highlight the notes which I pick out to be relevant so you can see what I'm doing. The patient's name and date of birth are going to be important to include in the RE line of the letter, but there is no requirement to include their address, so I can ignore this detail. The reason for presenting is going to be important to explain to the reader that the patient has had a back injury at work and that their employer is supportive. I can see that the medical history and the first part of the social background is not going to be relevant to this situation, but I can find more details about the patient's work, that they drive a forklift in a large warehouse which requires prolonged sitting and occasional heavy lifting. Both of the current medications are for pain relief. Because the occupational therapist is not going to be involved in monitoring these medications, perhaps just the name is going to be important to mention. Now we come on to the history of the condition. I noticed the dates start in May 2019, so I skimmed down this column to get a sense of the timeline, which is going to be important for me to communicate to the reader. I can notice that the patient has had monthly appointments, 4 in total, up to today, which is in August. To be able to get a clear understanding of the progression of the back injury, I'm going to want to read the case notes a couple of times before I decide what's relevant or not. Some of the earlier details may now be superseded by more recent details, so I want to be careful to only include the information the reader needs. The patient presented after 4 days of the initial problem at work, which is mentioned as a result of lifting a heavy box off the floor at work. He didn't rest and the pain worsened. An X-ray ruled out any disc problems. And my initial diagnosis of severe lower back strain is obviously going to be important. From the treatment section, I noticed that exercise and a referral to a physio were recommended and that the medication was started. I can also notice that 30 days off work and a review in 30 days were organised. At the review in June, I can see that the patient's back was still sore and that he was still moving very stiffly. He had been completing the physio, but described the exercises as very painful. He'd also been walking for up to 10 minutes per day. Another 30 days off work were arranged and another review in 30 days. In July, the recovery had started, but the patient is still in pain and still moving very stiffly. He's still attending physio and exercising a little bit more each day, but describing it as very tiring. One of his medication dosages was increased. And again, another 30 days off and review were organised. At today's appointment, the recovery is continuing, but he's still in pain and moving stiffly, but with an increased range of movement. Specifically, I noticed that the pain is increasing after 20 to 30 minutes of sitting or lying down. The patient is still attending their physio appointment and still walking, finding it very tiring, but has increased to 30 minutes per day. In the discussion section, I notice that the patient is bored and discouraged and wants to return to work. Finally, that my recommendation is that the patient does return to work, provided no lifting and with regular breaks. Going back to the start of the history, I now have a better sense of what is important or not. The marital and children history definitely isn't relevant. From the first visit, the details of how the injury occurred are important, and the overview of the treatment, exercise and physio. While the medication would be important to another physician, this is not something the OT will be involved with, so these details can be omitted. The June-July visits are fairly similar, which makes me think that I will summarise these together into how the condition improved. The final visit information is all important and will be in its own paragraph. Having reached the end of the case notes and talking myself through the situation, I now feel I have a good understanding of Mr. Jones's history, but also how I'm going to structure my letter. If I still have time left out of the 5 minutes reading time, I would read through everything again carefully, reminding myself the decisions I just made. Once the writing time starts, I would now underline those notes which I highlighted for you, so I have a clear record of the information I want to include in my letter. I would also turn to the blank page on the back of the answer booklet and make a very rough plan of my letter structure. In the introduction, I will explain the referral by mentioning Mr. Jones's back injury and the need for a workplace assessment. In the middle paragraphs, I will cover the physio and exercise treatment Mr. Jones has been following and his current condition. In the final paragraph, I will make a specific request to the occupational therapist, including the advice about which work tasks will be appropriate for Mr. Jones to perform. I'm now ready to start writing. I have a clear plan in my mind, and it should be easy to record all the information in the 35 minutes I will have left, and still keep some of this time to check my work at the end. I'm not going to write the whole letter now, but just to point out a few things. Opening my answer booklet, I'm going to start with the reader's name and the address, which I can copy directly from the writing task. Underneath this, I will add the date, which is today in the case notes, the 30th of August 2019. Next comes my greeting, Dear Ms. Graham, followed by the RE line. But remember, the order of the greeting and the RE line can be reversed if you prefer. So here the RE line is Mr. Barry Jones, DOB 11/06/1973. Then will come the body of my letter, the paragraphs. The introduction, introducing the reason for writing, then the treatment paragraph, the current condition paragraph, and finally the specific request paragraph. Underneath all of this, I will add my ending, yours sincerely, and finally my job title, Doctor. As you write the paragraphs, think about how you will summarize this information. The aim is not to write one case note per sentence. For example, the middle visits do not need separate mention, but can be summarized into a trend of gradual improvement. Once you have finished writing, use any time you have left to check your letter against the case notes you underlined to make sure you have included everything you identified was relevant. Read it as the occupational therapist. By the end of the letter, do you understand Mr. Jones's situation and what you need to do for him? If necessary, make edits to your letter if anything needs clarifying or adding. Now you have your completed letter, it's time to look at the sample answer. There are some important things to remember with sample letters for official OET tasks. They have been written and checked by both language experts and a medical subject matter expert to make sure they are accurate medically and linguistically. That doesn't mean that they are perfect or seen as the only way to write a letter about these case notes. You might have used slightly different language or structure to your letter. Provided you have communicated the situation as per the task clearly to the reader, this will not be a problem. When reading the sample answer afterwards, notice the similarities and differences. If there are any differences, rather than seeing it as something that has to be corrected in your letter, think about why it is different. Why do you think the writer used this word or phrase? Is it more formal? Does it allow them to summarize some detail more effectively? Why do you think they structured their letter like this? Is there any difference in clarity between your version and their version? I want to finish off by giving you a few tips about how you can get the most out of this set of case notes after you've written the letter. Don't just discard this task and letter and move straight on to another task. Take time after each practice letter to learn from it and avoid making the same mistakes next time. Here are 5 things you can do to get the most value out of each practice task you complete. Assess your writing and the sample answer against the assessment criteria. The criteria are free to download from the OET website and contain both a description of the 6 criteria you are assessed on, as well as the evidence of what the assessors are looking for to be able to score you at the different levels. Take each criterion in turn, read the evidence statement for each level, and critically decide which statement is the best match for your writing. Type your letter into a document and check your language and grammar by using free tools such as Grammarly or the spell checker and grammar functions built into your word processing software. Notice the mistakes that are picked up and use them to create your own checklist of common errors to learn from. Rewrite your letter so you have a perfect copy to refer to as you revise. If you keep looking at your original letter with the mistakes in it, you are training your brain to remember the mistakes. Having a perfect copy to revise from will help improve the accuracy of your writing. Use the case notes as the basis for a speaking role play. Imagine you are having a conversation with Mr. Jones in August. Ask a friend or colleague to play Mr. Jones's role while you negotiate with him terms for him returning to work. Search the internet for podcasts on workplace injuries or medical journal articles covering recent developments in the treatment of back pain to practice your skills for the reading and listening parts of the test. Remember, with the right approach, the writing test is something everyone can do well. For more videos and test strategies, follow our social media channels on Facebook, YouTube and Instagram @official OET, and search the OET blog available on our website.